This is the story of a man whose face became a symbol of transformation and tragedy. A journey that began with a simple injury and led to an endless series of procedures. This is about Michael Jackson's struggle with his appearance, illness, and the crushing pressure of fame. Step by step, we'll trace his transformation. From the first nose surgery to dermatological treatments and the final attempt to restore his human face. In the late 1970s, Michael injured his nose, reportedly during a dance rehearsal. The damage wasn't just aesthetic, it affected his breathing. He turned to renowned plastic surgeon Stephen Hofflin, who performed the first rhinoplasty. It was a standard correction, removing some skin and reinforcing the nasal bridge. When Michael saw the result, he wanted more. He thought his new nose could be even more refined, closer to his ideal image. He underwent a second surgery. While the nose became more elegant, his breathing issues worsened. That led to further interventions, and over time the tissues began to thin. Each new procedure became not just cosmetic, but necessary. The structure of his nose weakened, and he found himself in a cycle of constant corrections. In 1984, everything changed. During a Pepsi commercial shoot, pyrotechnics misfired, setting Michael's hair on fire. He suffered second-degree burns. The scalp was severely damaged, and a bald spot formed at the crown that couldn't be covered naturally. Doctors performed a skin graft, but scars remained. From that moment on, Michael began wearing wigs, and sometimes hats, especially during recovery. There's a well-known home video where he practices his dance moves, possibly the moonwalk, wearing a hat. In the same footage, a bandage covers his nose, indicating another simultaneous surgery. At that stage, facial procedures became more and more frequent. His appearance was constantly changing, and so was his confidence. As time passed, new problems emerged. In the early 1988s, Michael was diagnosed with vitiligo, a rare skin condition that causes pigment loss. Later, lupus was also diagnosed, which further damaged the skin. These illnesses overlapped with surgical consequences. Dermatologist Dr. Arnold Klein stepped in. He treated the skin, used lightening creams to even the tone, and addressed the collapsing structure of Michael's nose. Using dermal fillers like hyaluronic acid, Klein tried to restore both shape and function. At one point, they achieved a balanced result, but it didn't last. The treatments had to be repeated, and over time, even those became less effective. Meanwhile, Michael decided to alter his chin, requesting a small cleft, which he believed would enhance his features. That procedure was simple, but as years passed, his face changed drastically. His cheeks became fuller, his lips thinner, his gaze more fixed. Surgeons and journalists speculated about cheek implants, brow lifts, lip augmentation, eyelid surgery, and chemical peels. Michael only acknowledged nose and chin surgeries, but experts agreed there were many more. His face had taken on a porcelain-like quality, rigid, stylized, almost mask-like. Michael's skin diseases demanded constant cover-up. On stage it was makeup, off stage it was hats, glasses, scarves. He hid from the world. Photos often showed him with a bandaged nose, an indication that surgeries were ongoing. The medical world split in two, one side treating illness, the other correcting past procedures. These goals often conflicted. The skin couldn't handle more surgeries. Infections, inflammation, tissue collapse. It became a vicious cycle. Michael insisted he wasn't addicted to surgery, but he was no longer in control. The procedures became part of his survival. In his final years, Michael and Dr. Klein were planning a restoration. The goal was to soften his features and bring back a more natural appearance. Some say Michael considered a facelift. He may have been preparing for it, especially during his comeback. But he passed away in 2009 before any of that could happen. The final chapter was never written. The last attempt to return to himself was cut short. Michael Jackson's face wasn't just a story about plastic surgery. It was a tragedy about identity. He was a man who wanted to be perfect but lost himself in the process. The surgeries began with a broken nose. They ended with a man who felt broken inside. Behind the ever-changing features, there was someone fragile, someone searching for peace. He wanted to be beautiful, flawless, light as his dance. But the weight never left. His face became a symbol not only of fame, but of pain. Maybe all he really wanted was to feel loved